Good morning, Nassau. It is currently 7 a.m. Sunday, October 20th. I am Petronique Davis, your anchor for this morning's news. Breaking news, we have official reports of a rising outbreak of gonorrhea cases in the Caribbean region. Now, if you don't know, gonorrhea, also known as the clap, is a sexually transmitted infection that has once again become prominent. We'd like to take this time to inform you of some related information, safety, and preventative measures. But before we do so, I'm going to turn it over to our reporter in the field. Take it away.
Thank you, Petronique. Gonorrhea, known as the clap, is caused by the host-adapted human pathogen or bacterium Neisseria gonorrhoeae, which has had a widespread outbreak that can be transmitted through unprotected sexual activity via oral, rectum, vaginal, anal, or any route containing the exchange of sexual fluids. Neisseria gonorrhoeae exhibits high genetic variability, enabling it to adapt and evade the immune response. Gonorrhea is transmitted through mucosal surfaces during sexual contact, typically infecting the urogenital tract, but it can also affect the eyes, nasal, pharynx, throat, and rectum. Unfortunately, it employs antigenic variation of its surface proteins, which helps it evade immune detection. Infants can also acquire the infection during childbirth, which primarily impacts their eyes and can lead to serious complications. It is important to understand gonorrhea as it is crucial for public health, as informed individuals are more likely to engage in preventative measures, thereby reducing transmission rates. Clinical manifestations include the symptoms of the disease, whether asymptomatic or symptomatic. Symptoms typically develop within a week of exposure, prompting timely medical care, diagnosis, and treatment in areas with accessible health care. In populations where oral or anal sex is common, asymptomatic infections in these sites may be more prevalent than asymptomatic urethral infections, which can be treated quickly. Without screening for asymptomatic cases, many gonococcal infections can go undetected. If left untreated, cervical gonorrhea can lead to serious reproductive health complications. In rare cases, gonorrhea may progress to bacteremia and systematic involvement, resulting in conditions such as septic arthritis, endocarditis, and occasionally meningitis. Additionally, gonorrhea is associated with an increased risk of HIV acquisition and transmission. Historically, gonorrhea is known to be one of the most oldest sexually transmitted infections known to humankind. There is some conflict of opinion regarding the exact origin, but according to the consensus, the disease has been present from ancient times. Gonorrhea was diagnosed by gram stain of the purulent exudate from a patient showing gram-negative diplococci among polymorphonuclear leukocytes, neutrophils. Neisseria gonorrhoeae was first identified in 1879 by German bacteriologist Albert Neisser. He isolated the bacterium from the past of the patient with gonorrhea. This discovery was significant in understanding the causative agent of this sexually transmitted infection. Neisser's work laid the foundation for further research on the bacterium's biology, transmission, and treatment. Over the years, advances in microbiology and genetics have expanded our knowledge of gonorrhea, including its pathogenic mechanisms and antibiotic resistance. Back to you, Petronique.
Yes, thank you for the insightful information. To combat this global threat, it is essential to strengthen prevention and control programs and develop novel preventative strategies. Understanding these transmission dynamics is essential for effective public health strategies. So far, treatment options for this STI entail antibiotics prescribed or administered by your physician, whether oral or intravenous, as well as the use of condoms for further future contraception prevention.
Risk factors may include multiple sex partners, younger age, previous gonorrhea diagnosis, having other sexually transmitted infections, a new sex partner. Symptoms. In many cases, symptoms may not appear, but if they do, they occur 2 to 14 days after exposure and may include, in men, painful urination, pus-like discharge from the tip of the penis, which may be yellow, white, beige, or greenish, swelling or pain in the testicles or scrotum, swelling or redness at the opening of the penis. In women, increased vaginal discharge, watery, creamy, or slightly green, painful sexual intercourse.
Do you wish to end up like this? I am sure you don't. So, please consider the importance of the information provided to you today. We encourage and advise you to not miss your checkups, stay protected, and remain safe. Thank you for tuning in to You Hear It Here First News. Good day.